CommonWell TV coming to you live from Las Vegas and HIMSS 16. Wow, this place is going crazy. What an exciting place it is. Probably because we're now at eClinicalWorks. A lot of exciting things happening here. We're joined now by Tushar Malhotra, the Interoperability Lead with eClinicalWorks. Great to have you. Thanks for having us. Thanks for welcoming us. Let's jump right to it. So, in what ways does your company hope to contribute to CommonWell and its mission to make health data available to providers regardless of where care occurs?
So as you know, eClinicalWorks is the largest vendor, cloud-based EHR vendor out there. And we have a lot of providers on our network. If you look at the numbers, it's 115,000 providers who are using our EHR. There's close to 600,000 users of our product, and then close to 220 million patients who have their record in the eClinicalWorks EHR. So essentially, if you add all of that together and add that to the network, you are making the CommonWell network more powerful, more usable, and essentially make the goal of the ubiquitous interoperability more achievable.
Those are impressive numbers. In what ways do you see CommonWell helping to break down barriers to nationwide data exchange?
So as we see right now, the healthcare industry is pretty much very fragmented and the data is in silos. It's often compared to the banking sector of the past, where if you did not have the right ATM access, you are not able to access your account. And that's where CommonWell comes as a change agent, because it allows the patients or the providers to stay within their EHR workflow, request for information from external sources, and utilize that information for better care of the patient. And it's not like this hasn't been attempted in the past. It has been attempted in the past, but not to this level. Often, there have been state, regional, or private health information exchanges who would ask for information to be pushed into a portal, and then the physician would be expected to log into the portal to view the data. That's where CommonWell is breaking ground, because it allows for physicians to stay within their workflow. The biggest beneficiary out of all of this will be the patient, because they don't care whether you are using EMR A versus EMR B. They just want better care. And that's where CommonWell will help.
It is about the patient, is it not?
Yeah.
So how is eClinicalWorks currently working with its clients to further interoperability access across the care continuum?
So eClinicalWorks is starting this year. It's becoming a very open system. We will work with any interoperability initiative, whether it's a state, regional, private, or public, or even a national initiative. Any kind of initiative, we will support that. And we'll do that at a cost which is minimal or pretty much no cost to the providers. And one good example is that eClinicalWorks is committing to provide the CommonWell services to its customers at no cost for the next few years.
All right, so let's close with this. So what do you think will be the most significant change in nationwide interoperability in 2016?
I personally believe that the access to the providers for their patients' data, that puzzle is pretty much being solved, or it's close to getting solved. Now, with the adoption of newer standards and technologies, whether it's content standards or it's exchange standards, like FHIR, which is Fast Healthcare Interoperability Resources, or Smart on FHIR type of technologies, more API-based integrations, the timeline is going to reduce. And where it's going to benefit the most is that the patients will now be able to access their data. So if you are using a patient portal from any company, you will be able to get access to your record from multitude of sources. And I think that's where the biggest change is going to be in the next few years.
Yeah, that's very exciting. All right, before I let you go, where can people go to learn more about eClinicalWorks?
So eClinicalWorks, they can look at the eClinicalWorks website. We have an interoperability page where they can learn more about what we are doing in terms of interoperability. And they can always contact eClinicalWorks through there. So our customers can create a case and contact us, and one of the representatives will be able to guide them through the options that they have when it comes to interoperability.
Outstanding. All right, Tushar Malhotra, Interoperability Lead with eClinicalWorks. Great to have you. Thanks for welcoming us. CommonWell TV signing off from Las Vegas and HIMSS 16.